Step therapy refers to what is also known as the fail-first philosophy, where an insurer mandates a specific drug in a specific indication because it's a lower cost alternative. And that has a lot of negative consequences in oncology where the stakes are so high and you really have to give the patient the best drug in the appropriate setting. We've seen step therapy in oncology mostly to date in supportive care drugs, but drugs that have potentially profound impacts on patients. And one example is the use of denosumab as a bone targeting agent, where many insurers, but not all, recommend a first step of using unbranded agents like pamidronate or zoledronic acid. And those are actually the first and second generation of bone-targeted agents. I've been involved in the development of all three generations, if you will, and it's interesting that we're still being recommended to use a drug that was at its heyday in 1990. So that has profound effects. If a patient has a skeletal-related event, that means they have a fracture or they have surgery or admitted to the hospital, and those are serious events. So this is not measuring a lab test like a cholesterol level or the blood pressure, which gives you harm over years. This is something that can be an immediate effect. It's also arbitrary. And the reason it's arbitrary, if you look at across the schedules from different insurers, there's an insurer who will allow denosumab, and another insurer that will allow it in prostate cancer, but not in other cancers, despite the data being similar. So the complete antithesis of where we're going towards personalized medicine. This is completely impersonalized. It's based on a lower cost alternative without regard to efficacy, without regard to safety, and only focusing on the specific immediate cost of the drug and not the consequence of the total cost of the drug and the therapy going forward if there's a complication. So I understand the rationale for step therapy. Everybody wants to rein in costs. This is a relatively simple way for the insurer to make it right up front, to have predictable lower costs for certain things. But for cancer patients, it has dramatic consequences. And now we're getting into the situation where large insurers have step therapy for therapeutics. And that, to me, is really scary. They're going to tell me which form of a drug, which can be very different, or different drugs completely in a class of anti-neoplastics I should use without regard to the specifics of the patient's past medical history, their preferences, what's important to them. The exact opposite of shared decision-making. No decision-making except at the insurer level, taking the physician and the patient completely out of the conversation.